When we commenced on this process with Personify Care, it surprised me how quick and easy it was. I wasn't sure initially about how we were going to manage that, but it became very clear very quickly that with the support of the team from Personify that we were going to meet the goals that we required.
So within Outpatients, our virtual fracture clinic was initially adapted for our rural patients. We wanted to prevent them from having to travel down to the city, taking them away from their families, their work, when often it was just a probably quick 5-minute conversation, and to be then go, well, do you know what, your GP can manage that.
So all patients do get an evaluation sent to them within a week after their procedure, and the feedback has been exceptionally good. And it actually makes it easier for people with second language and those that are deaf, because they're able to access it and email back. Everything is just done on the digital pathway, and it's just so much easier.
With Personify, we can send out the questionnaire. Based upon the feedback from that questionnaire from the patient, we can determine their medical plan. Once we have that medical plan in place, they can either have a telehealth conference, which is a video conference, or via phone conversation with one of our clinicians. Patient can instantaneously receive their plan of what they have to do. They've got it, it's documented, and it's really clear. We've actually now expanded that to our city patients as well, knowing that it's just as inefficient for our city patients to have to come to hospital and find a car park, also be taken out of their family, their workplace. So we've certainly seen the benefits for not only our rural patients but also for our city patients.
The implementation of the Personify pathway has changed my daily workflow for the direct access nurse role significantly. It has meant that we are able to book our lists, and instead of being 6 to 7 days, we are now booked 6 to 8 weeks in advance. So we're able to process patients at a much faster rate and yet still provide the same level of clinical oversight that we did previously. Would I recommend Personify Pathway to other health services? Absolutely I would, and absolutely I do. It has made an enormous difference to my work life here within the Queen Elizabeth, and I have honestly told them if they take it off me, I will look at retiring.